Hi, I'm Dr. Maureen and I'm from Skin Renewal, and today we're going to discuss the difference between microneedling and RF microneedling.
At Skin Renewal, we combine doctor-led care, cutting-edge technology, and a holistic approach to deliver personalized solutions that truly transform your skin. Just what you need right now.
So the biggest difference is that the RF microneedling not only does mechanical microneedling, but it also has heat that runs through those needles. So that's the biggest difference. And that can make a difference, having a treatment like the microneedling, you might have to do 4 to 8 treatments. With the microneedling, you'll do 2 to 4 treatments. And the different conditions that it treats, they both treat wrinkles, but the microneedling, you'll do more superficial rejuvenation of fine lines, wrinkles, pores, and texture. And the hot needling will do exactly the same, but you can address deeper wrinkling, deeper pigmentation, and then obviously with the heat, you're going to get skin tightening because it's instant. When the collagen fibers are heated up, they immediately contract and you get instant tightening. And then what happens down the line with both of them, you get the lymphocytes rush in to fix this micro injury that you've caused. So after 2 weeks, these lymphocytes recruit the fibroblasts, which start spinning collagen and elastin. And that carries on between 90 and 120 days. So even though you've had the treatment, you'll find the best results come down the line at 120 days, which is about 3 months, because that's when you get further tightening and you get remodeling of the skin, and then you get further tightening of the skin. Obviously, much more tightening if you've had RF microneedling. So they both address superficial, well, the microneedling addresses more superficial. They both address basement membrane incontinence, which means that there's communication between the epidermis and the dermis. But the hot needling, you can program those needles to the depth of 3 micrometers, which is exactly where that basement membrane is. And then you can heat it at that level to improve that basement membrane so that you don't have communication between your epidermis and your dermis. And very often what happens is melanin cells fall into the dermis because you've got these openings. And then you get these melanocytes in your dermis, which aren't supposed to be there, that the pigment cells. And then a big giant cell comes and eats it up, and then nothing can carry it away. So that's where RF microneedling comes in. And the beauty is you can get insulated and non-insulated needles with microneedling. And if you want to reach just the area where these large pigment cells are sitting in the dermis, you put it at a certain depth and you use the insulated needles because you won't affect the epidermis. All you're going to do is affect where the heat is at the tip of the needle. And then another benefit of microneedling is that you've got these, you can use non-insulated needles, and at Skin Renewal we have both machines. The one where you can get insulated and the other one where you can get non-insulated needles. And the non-insulated needles will decrease spider veins in the area because the heat of the needles now can reach the spider veins and coagulate them. So that's the difference between microneedling and RF needling. And they both treat the senescent cells in the skin, but obviously the RF needling has got a much higher effect on senescent cells because what it does, it takes those cells that aren't behaving well in the skin, they're causing chaos in the skin, and it destroys them together with also taking out some of the normal fibroblasts. But you'll find that your normal fibroblasts will bounce back because the microneedling makes these thermal zones with normal tissue in between which regenerates. So that's the beauty of the RF microneedling. And then once you've done your treatment either with the microneedling or the RF needling, at Skin Renewal we have the multiply effect where we add a serum or we add something extra to the skin. So my favorite is the PRF, and that's the new kid on the block, the big sister to the PRP. So after you've had the microneedling, the doctor's already spun your blood draw down with a special machine and a special blood draw and a special spin protocol in a special tube. hands it over to the therapist who's prepared your skin with the microneedling or the RF needling, and you've created thousands of little entry points, and she just applies it and it sinks deep into the skin and the dermis. There are many other options that we can do post-needling, post both needlings, and I suggest there's PRP, there's the synthetic growth factors, the DermaHeal SR, so it's like synthetic PRP. Then we have the PDRN, which is a salmon sperm facial, which is amazing for healing and for regeneration. And then we have hyaluronic acid with peptides and hyaluronic acid with senolytics, like Senescent, which helps to take out those senescent zombie cells. And we have an amazing prescription strength retinoic acid peel, which we can apply on afterwards. Well, what it does, once they apply it, it's like instant relief, and you keep it on for about 6-8 hours, and you will peel on day 3-4. So just program it that you're not going for a function, because you will peel for 3 to 5 days. That's another option. So we also have serums that will help for pigmentation with tranexamic acid in. So microneedling, hot needling, both great. The one you need 6 to 8 treatments, hot needling you need 2 to 4 treatments. So one more thing on RF microneedling, there was an incredible study done in Nature, which is one of the most prestigious scientific magazines. And they did this study on RF microneedling, and they found that the collagen and elastin was stimulated up to 30% after treatment. So it's quite incredible, coming from Nature magazine.